Namaskaram. Thank you and welcome back. In our journey in understanding about health and why we are so sick, I think one of the very important topic is cholesterol, because there's so much of fear about cholesterol, and many of you all are afraid that the cholesterol will give you heart disease. Okay, so let's understand it this way. Cholesterol is a very important molecule in the body. It is there right from birth. Plenty of cholesterol is there in breast milk as well. Cholesterol does a lot of healing in the body. So whenever the body needs to heal itself from injuries or whenever there is an infection, cholesterol will automatically rise because the body will increase the cholesterol production from the liver. Okay. Then if you look at the types of cholesterol, most of us are afraid of what is known as the LDL cholesterol, low density lipoprotein cholesterol. But the problem is the other cholesterol called triglycerides, which is TGL. So why is the triglyceride high? Because if you eat a high carbohydrate diet, take a lot of sugar or all those high fructose corn syrup sweetened drinks, your triglyceride will go up and there is no effective treatment to reduce triglyceride. Maybe that's the reason why we don't talk about it, because we don't have an effective treatment. What does triglyceride do? It will lead to fatty liver, and that is a big health concern. So we can discuss about fatty liver next time. So the LDL, please understand this. The LDL cholesterol is the mother molecule from which the body makes many other important molecules. One of the most important product of cholesterol is your hormones. So all the steroid hormones in your body, like testosterone, a male hormone, estrogen, progesterone, the female hormones, or even pregnenolone, which is the grandmother of all hormones, and the adrenal hormones, DHA and cortisol, they are all made from cholesterol. Vitamin D, the life-saving vitamin for bone health and immune health and sleep and depression, and for overall health, is made from cholesterol. So if you have low levels of hormones, that happens as you age. If you have low levels of vitamin D because you don't go out in the sun, or if you have low levels of a vitamin called Q10, which is very important for heart health, the body, being very intelligent, will increase the production of cholesterol in the liver and the LDL level will go up. So when we read the raised LDL level, we attach it to atherosclerosis or the plaque formation in the blood vessels that leads to heart attack and try to bring it down. What happens when you bring down these cholesterol levels? You will lower your hormones and vitamin D and Q10 and many other essential molecules even low. So can it give you better health? So what is the solution? As I always mentioned, treat the root cause. If the cholesterol is high, if it is because of low hormones, correct the hormone levels. If it is because of low vitamin D, correct the vitamin D. If it is low because of low Q10 and any other molecules, correct those. That is treating the root cause. This is functional medicine. This is upstream medicine. Because if you bring down the cholesterol, you are going to reduce all these critical molecules for health. So that is not a good solution. But there are natural solutions to lower cholesterol levels like vitamin B3, which is known as niacin. The results will take some time, the effect is slow, but it has got many other benefits, including its ability to reduce increased triglycerides and to treat fatty liver. So if cholesterol is high, it is not necessarily a cause of heart disease. Why is this so? Why does cholesterol sit in a blood vessel? We call it as a cholesterol plaque. What happens is this. Whenever the lining of your blood vessels called vascular endothelium is damaged, the first thing the body does is call for help from cholesterol to seal the inflamed part or the injured part to prevent it from rupture. Then in order to stabilize or make it stronger, you have red blood cells, you have platelets, you have fibrin which will sit with cholesterol. And finally, to make it tough so that it seals off, doesn't get washed away, calcium gets deposited. We call this an atherosclerotic plaque. And so we claim that this leads to heart disease. But what is the root cause? The root cause is injured vascular endothelium because of chronic inflammation. So as always, look for the root cause. Healing is only possible if you fix the root cause. Okay, thank you very much. Namaskar.